TNT Open Mind Insights brings you powerful, authentic conversations, illuminating the path to better mental health care for all.
Good afternoon, Luke Tharasri. We're super excited to have you join us today and talk about the work that you're doing in the field of mental health. So, thank you for joining us.
Thanks for having me.
Yeah, so um, you're doing some amazing work. You've dedicated your life and your career and what you do now to mental health and wellness and helping people. So, my first question is always going to be, who are you? Who are you, Luke? Like, Luke, why is your heart caring about this so much?
Yeah, and I mean that's a great question. It is probably a recent kind of discovery, if you will, of why I've been passionate about it. So, kind of education-wise, I did my degree in psychology, and then I got my master's in healthcare administration. So,
Mm,
very kind of nerdy from that perspective in terms of always wanting to go into healthcare and do something within healthcare. My mom was a nurse, so I just kind of said, okay, let me kind of pursue that route, if you will, and not knowing anything about mental health, just knowing that kind of traditional healthcare system and whatnot. And then kind of went up the ladder that way in a community hospital setting. Became hospital CEO for several hospitals across the country, and really just seeing this siloedness between the way we treat and approach psychiatric patients or those that are afflicted with mental health issues, and kind of the other normals, right? The ones that are coming into your hospital with pneumonia or the flu, or having their baby, or getting their knee replaced and things like that, right? And so um, the system is designed in a way that it's kind of geared was designed in a way that was more geared towards dealing with your physical ailment, your issue. But if a psychiatric patient comes in your ER screaming, and typically it's the same patient kind of day in and day out, right? They're not getting the right resources. They're kind of painted a certain way, and
mm,
so kind of saw that disconnectedness. And so technically, when in my professional life, started seeing that there was a need for better care for
mhm,
psychiatric patients. But then an epiphany, or I guess a discovery, came relatively recent. A few years ago, I was going through kind of this leadership retreat thing, and we were kind of doing the same thing, introducing ourselves and whatnot. And it was a group of executives that were together and exploring kind of leadership styles and kind of how you can be a more effective leader and work with people and stuff like that. It just happened that there were a lot of female executives that were going through this, and it struck me, and then it hit me hard that as we were talking through some personal kind of same question, right? Kind of who are you and your personal. I forget what the topic was, but essentially we got onto the topic of um, being going through as an executive, and for them as female executives, and having to kind of break through glass ceilings, and then having bouts or experiences with abuse, and
mm.
particularly sexual abuse. And that just triggered a repressed memory in me. I mean, it just came
Oh my
out.
gosh.
It just flooded out, and a memory of my at the time, an older male cousin raping me as a
Oh
child.
my
And
god.
so, and it's not like I purposely didn't talk about it. It's the brain is a powerful thing, right? It's trying to
Yeah,
preserve life, and it did its job.
yeah.
It really repressed that memory. Um, but for them to be able to speak as strong female executives, be able to speak vulnerable, kind of in a vulnerable state about that, um, then I guess allowed me to have that bubble out,
Well,
right?
you had that safety because
Yeah,
people were sharing.
exactly. And I think that's the point, right? Is that
Yeah.
now you kind of, it's a long answer to your question,
No,
but now
great,
really
yeah.
the mission is, I want to be able to uh, provoke and kind of stoke vulnerability in the organization that I run, but with people that I meet,
Mhm.
lead with vulnerability, lead with radical transparency in a way that hopefully becomes disarming, right? And
Yeah.
tells people that, yeah, I've been through it too. You might look at me on the outside. I'm a CEO of an organization, and this educated person that kind of whatever is doing well in life. But I certainly have trauma. I've got trauma that is in the fabric of kind of who I am, and it's led to some certainly poor behavior as well. But it's hasn't certainly stopped me,
Mhm.
and I recognize it in in this way. It's been, you know, going through something like that, and I know others have as well. Obviously, it kind of is dehumanizing in a way, right? It's demeaning, if you will. It's uh, creating a feeling of less than, right? So I've had to deal a lot of that
Because
with.
of the
Right.
trauma gives you that
Right,
feeling. Okay.
exactly. And especially in that manner of someone kind of dominating you in a sexual way, right?
Yeah, yeah,
Without your consent,
yeah.
obviously. And and um and so I've had this chip on my shoulder a lot where I haven't felt, you know, in equality, or
Mhm.
I'll question myself, have that imposter syndrome at times and things like that. I only say all this to say that I want other people to feel like they can have a voice and talk about those things and be an executive, or and
Yes,
run something, or
yes.
and build something, create something. Um, and it's okay to talk about it. It's okay to be you don't have to put on a facade all the time, right? Life is tough, and the things that we go through are tough, but that's why we're in this business, to hopefully be able to tell your story, so then you can help other people. And that's really in our organization with with mindful living centers, is that we've kind of gone all in on this concept of using um, I don't want to call it lay people,
Like
or whatever,
counselors,
lay
some kind of
counselors,
thing.
but really they're community health workers that have lived experience. And what we do is depending on the population we serve, which we serve all, right? So whether you're a military veteran, LGBTQ, um, black, white, Hispanic, whatever, Asian, what we try to do is hire folks of the community that reflect the community and the community that we serve,
Yeah,
right? So
yeah,
then
yeah,
when you're talking to someone, whether it's, I'm talking, if we have a professional track, if you will, and it's me talking to them, then you can kind of relate to
yeah,
their plight, and then hopefully to their trauma or anything kind of that they're dealing with, right? And so it's the same with the other what we call kind of care coordinators, is that um, we want people with that lived experience to then be able to be vulnerable, share what they've gone through, but then really more importantly, be able to kind of empathize and provide the right uh, care to folks that's meaningful and significant and really kind of is relatable. So
yeah. That
yeah,
makes a lot of
yeah,
sense. I mean, I felt more free just hearing your story and being like, these things happened, and I'm a CEO."
yeah,
You know
yeah,
what I mean?
yeah,
Because it's I run a company and I've also gone through great trauma,
yeah,
and I think
right,
most of us have something like that, but we
absolutely,
keep
right,
it hidden because we think we're going to be judged.
right,
But it's really in those moments of connection and seeing how much we share
hmm
that we begin to heal. And how what was kind of that journey from that moment of vulnerability to building it into a model? Like, did that happen quickly, or was that like, okay, I realized this thing and then it took a while for me to integrate it, or did we like, okay, this is it, this is what I need to do?
Yeah, no, that's a great question. Yeah, I mean, I think it certainly was a catalyst, right?
Yeah.
And it was probably a I shouldn't say it happened quickly, although when maybe you look back at it,
Yeah.
probably in big scheme of
Right,
things,
like, wow.
yeah, yeah, it happened kind of quickly. But yeah, going on the journey of, again, the polished hospital CEO, right?
Yeah.
And I would always wear a suit, tie, and of course I'm not wearing that today. So being more authentic, like taking off that mask, taking off that
Yeah.
facade, right? Not to kind of disparage that, right,
Yeah.
at all. But there was, for me, my journey, and probably had to do with kind of that always having to prove myself type of deal, right? I always have to, go to the best school and then get the best job and go and continue to move up the ladder. And then another kind of pivotal moment in my life is I got laid off at some point. right? This
And
is
then they're like,
maybe,
"What?"
yeah, like what? Like how did that happen? Like
Yes, I know.
I got
Me?
my education.
I did everything
Yeah,
right.
look at my resume or whatever,
Yeah.
but then that's when you realize you don't control everything. You can't
Yeah.
control
Yeah.
everything. It wasn't your fault, and a lot of things in life aren't your fault necessarily, right? It's that life happens, right? And so that was a pivotal kind of identity moment. Like, what do I do now? And
Mhm.
kind of that's got me into the journey of okay, I have time. Let's do this retreat. Oh, now something else floods out of
Yeah.
me, right?
Oh my gosh. Oh, that happened right
You're
when it was
right,
okay.
like pretty
Yeah.
close together, right? But then that then led me to this journey of okay, I want to do something meaningful, right? And that the nonprofit that we spoke about before, which was just I want to do something good, right? I've been in this kind of rat race corporate world for a while, Fortune 500 companies and all that stuff. Let me just start a nonprofit, right? And it was originally called Tharasri Foundation. Now it's called the Mindful Living Foundation, right? Kind of in line with our mindful living centers. But really just to see how can we just give back, whatever it was. It was like kind of a journey. I called it like this. I went on this kind of 52-week journey. Like I worked with one nonprofit every week
And that was
to
in
kind
2015, right?
around
Yeah. Okay. So
2015, just to see okay who's doing what out there, what needs are there, where
yeah.
can we fill in the gap if there
Yeah.
was one, right? And what you find is there are a lot of great people out there doing great work,
Hi.
right?
Yes.
And so there's
Oh.
no shortage of that. And so it just landed upon okay this certainly it always led with healthcare, right? Just that's who I am, what I know, but really then understanding that health is more than just your health, right? Like what your lab
Physical health.
results and
Yeah.
stuff like that, right?
Yeah.
But it's certainly your mental health and your spiritual health, your financial health, and everything kind of is into one. And I think that kind of led us down to certainly looking at behavioral health as an underserved or when maybe the wrong word, but certainly an underserved environment or a less developed environment than our kind of traditional healthcare system, right?
Mhm. Yeah.
And so then seeing that, okay, not just doing the nonprofit, but starting a business is that okay? There's this need for patients that are well, let me step back a little bit. Then the pandemic hit at some point, right?
Then there was that.
Right.
Yes.
Then there was that moment. So you're going in 2019 and 2020, and that's really then okay. There's three life things
Yeah.
occur, right? And so, but the pandemic exacerbated a lot of mental health issues,
Yes.
right?
Uh-huh.
And so, being mostly on the inpatient hospital side of things, um, now we're seeing that we can't even serve patients in that capacity. There's not enough beds. There's not enough providers.
Yeah.
And what are they? What are people doing when they leave the hospital or can't even get in the hospital at that point? So we saw this need. We got to create community-based centers, right? We got to put centers wherever we can and meet patients where they're at, specific to mental health, right? There was certainly the whole COVID and virus thing, right? But for us, it was okay. We'll deal with that. But okay, the ones that are having now problems with whether they can't, the isolation, they can't go anywhere, right? Our kids can't go to school. Depression, anxiety, people are losing their jobs, everything
Yeah.
like that, right? Obviously, people then turning to drugs and whatever other coping mechanisms they had available to them. We just saw there's a need that is just not being filled. People can come to the hospital, great, we're here for a crisis moment, but that's I think the problem with the healthcare system as it stands right now. It's very episodic, right? And
Yeah.
we need more longitudinal
For
care,
sure.
right? And so we saw that we could build a continuum of care out and we needed more capacity, right? So those are two kind of first principles that we went after is that a lot of hospitals um, nowadays are maybe 50% at 50% capacity full, right? So there's a lot of empty units, a lot of empty
Oh,
beds and things like
okay.
that. And it's just a lot of hospitals were built and they're monoliths of their communities, right? They're They've been there 50 years. The St.
Yeah.
Joseph's and the
Yeah.
St. Mary's and all those, right? And they're great. Uh, but over time, in a good way, medical technology has gotten better, right? Preventative care, healthier lifestyles, and being more proactive about your physical health anyway, right? Still a problem with mental health access and
Yeah.
capacity, right? And so we had the idea to go to hospitals, again, being of the hospital, and say, look, I know you've got empty beds, because I had hospitals and we were never full and getting less full over time because of, again, better care.
Yeah.
And so, d why don't we use those, empty units and turn them into psychiatric beds, right? Mental health beds. So, hopefully that'll allow a community to take care of their, behavioral health patients a little bit better from a crisis perspective, but that doesn't solve the other stuff. So it's like, okay, and then, oh, by the way, let's build out an outpatient continuum of care, right? So
Mhm.
once you're ready to be discharged from the hospital, you kind of go, hopefully get through that crisis moment, get the medications you need. Then, okay, we're going to transition you to get start addressing those underlying issues, right?
Mhm.
And so that's, kind of maybe done still, proximal or proximate to the hospital. But then, okay, when you go back to your home or your community, where are you going to get help, right? So that's where mindful living centers came out,
Yeah.
is that we've got to try to build where we can, centers that are available, and really just the grand vision. I mean, we've only have about 5 or 6 offices right now. I would envision something like a Starbucks, where you could have a mindful living center on every corner of America,
Oh
right?
my gosh.
And they don't have to be everything to everybody, but it's depending on the fabric of that community. So
Yeah.
if you're in a Hispanic community, then it would be, bilingual Spanish speaking of that lived experience. You can have one therapist that is there, and one community health worker. You don't need 10 and 20 or whatever it is to serve all. You just need to be able to serve that community. And then on the next block, it might turn into, now you're going into a West Hollywood type, and it's LGBTQ. And then so you'd have providers and staff that are positioned to help that community the best they can with their lived experience, right? And so you can have these kind of all over the place, instead of building one mega like monolith in the
Yeah.
community, right? And so
Yeah.
then you
That
you
looks the same and acts the same.
exactly, right, yeah. And so then then you are able to extend that care out further, if you will, and then hopefully supplement or augment that with technology like, telehealth or other technologies like that, right?
Yeah.
That can then, be able to again, spread your net out further, instead of having it all isolated into, or focused into one building, if you will, right?
Yeah.
So.
Well, this is brilliant, first of all. I mean, this is like just completely blown away by the idea. Like you really looked at this problem and just come up with this unique solution, and you're not just stopping at one point, you're pulling it through time.
Yeah.
So do you have then hospitals that are hosting psychiatric patients in their freed up beds then?
Yeah, yeah.
Yeah?
So we've worked with hospitals kind of, again, in several states. So we've done this model in California,
Yeah.
in the Chicago area, and in the Boston area. And we're always looking for certainly other people to work with. And there's just a number of factors that limit it sometimes. Capital,
Yeah.
like anything else, is hard sometimes, right? For hospitals to, you've got to convert these units
Yeah.
into safe units, right?
Yeah.
So instead of having, let's just use this room as an example. There's things called anti-ligature types of things. So this microphone, right? It's not anti-ligature because someone could hang themselves on it, right? And so you've got to look. So you think
Yeah.
of a typical hospital room, and you might not be able to envision it if you're not in healthcare, like us nerds are, right? But like things like sinks and doorknobs, and you've got to like look at all that. So that all has to be converted to like very smooth surfaces, right? Where people
Yeah.
can't
Yeah.
tie things on, and then there's got to be that visualization into
Yeah.
the room and things
Yeah.
like that. So things have to be reconfigured a little bit,
Yeah.
and so that comes with the cost. And then not every hospital can I guess invest in that
Yeah.
without some machinations or
Yeah.
trying to find some things. I think everyone is kind of willing to do it, right?
Yeah.
And I think there should be more available funding. I don't know what
Yeah.
that magic bullet is, but I think there should be certainly. I think that's been a rate limiting factor for probably for the mental health industry as a whole, is that there hasn't been a lot of attention placed upon it until now. I think it's getting better. There's more
Mhm.
talk about it. But all the dollars have kind of flowed the other way, right, or towards
Yeah.
physical health, because that's just what people know. And
Well,
yeah,
yeah, and
yeah.
we accept that as, being a worthy condition
R-
that somebody is not in control of.
right,
Yeah,
right, and that's
but
the
that's the
stigma of that.
stigma piece of it.
Right.
But I I mean, I don't work in hospital systems, but I was not aware that there were just empty hospital beds,
Yeah.
and how interesting that is, just as a, community shift.
Right, right.
That, like, it actually would make sense to bring in mental health to fill that space. And, like, what does it say about us as a culture that our physical health is improving and our mental health is either, would you say it's declining or it's just staying the same, we just haven't been paying attention?
Right. I think it's all of the above,
Okay.
right? It's like
Okay.
it's kind of it's so I'll step back a little bit, and I call myself a recovering hospital CEO at this point,
Okay.
because I think a lot of the hospitals, it's not the fault of the hospital, so I don't want to like come off of this hospital hater or anything like
No,
that.
no, not at
It's just
all.
it's I'm also an econ nerd by background, so it's you provide incentives for certain things, you'll figure out what the outcome is, right? And so the incentives have been aligned in a way where we've promoted, probably unwillingly or unknowingly, episodic care. So if you come in as a patient, we get paid for you. If you don't come in as a patient, we don't get paid for anything, right? And so that's typically how the healthcare system has worked. And so there's been this promotion of, we have to have patients come in. And so then there's
Mhm.
been this perverse incentive of wishing people sick,
Oh,
right?
yeah.
And you'll hear it from more than me, but and that's why I say I'm a recovering hospital. I don't want to wish people sick. I want to
Yeah.
wish people well,
Yeah.
right? And be able to make some money off of that, right? In a positive way,
Yeah.
and not have the perverse incentive of, oh, I hope people are sick this week, so then our hospital gets full. It's like that's not good, right? And so that's I shouldn't say it's a dirty little secret, but to your point is, people don't, a layperson wouldn't understand that, and probably think that hospitals are just, again, just because when they're sick, they go, right?
Mhm.
And they're
And it
there
seems
for
super
them,
busy.
right? And it seems super busy and
Yeah.
whatever. But there's a lot of empty units that you're not aware of,
Oh,
and there's a
wow.
lot of times of the year when it's not flu season that it's empty and things like that.
Wow,
So
that's
yeah.
fascinating. And it would take somebody working in your role
Mm,
to then look at this thing
right.
creatively and start developing a solution. That's why I find it so
No,
fascinating.
yeah.
Yeah. So living well health centers,
Mindful living
mindful living,
centers. Yeah, mindful
mindful
living.
living health centers.
Yeah.
How would you describe? I mean, you've said what it is,
Mhm.
but how would you describe, if you could pick a few words
Okay. Yeah.
to
Yeah.
describe the essence of your organization or what makes you different, what would that be?
Sure. I think a couple. Well, there's certainly a buzzword called whole person care,
Mhm.
right? So that's definitely one of our core principles. Is you come in, and it's not like, so I say this all the time, and it's probably very intuitive to you, is that your mental health is going to affect your physical health, right?
Yes.
And if you're depressed or anxious or whatever, it could raise your blood pressure, and probably exacerbate your diabetes and things like that, right? So definitely has effect on one another. But then there's that third leg of the stool, what we call the social determinants of health, right? So your income, your employment, your relationship situation, your housing situation, your nutritional situation. So I use the example of getting divorced, right? So if you get divorced, then of course all of a sudden your anxiety goes up. that's going to have a direct correlation to your blood pressure going up, right? And
Mhm.
so when you come in as a person, typically what's happened in the healthcare system, you go to your doctor, they're a cardiologist, they're just treating the heart problem, right? And then they're not dealing with your anxiety, and they don't know about your divorce, right? And so there's all these, so you never really get better. You kind of
Yeah.
get a little band-aid on it, right? But then you're not. So what we do, and it's not new, and it's not rocket science or anything, but it's like, okay, we're gonna treat you holistically. Like, we're gonna, when you come in, you're gonna get a care plan that involves all the above, right? What are your, we review your medical record. Okay, what were your physical ailments, and go through that, right? Okay, obviously you came here because you've got some mental health issues. So we've got therapists, we've got, community health workers, all this stuff. And so we need to figure out, like, what do you need from them, right? Or is it anxiety, schizophrenia, whatever, bipolar? Where are you on that scale of depression or whatever? And then what is your kind of home situation like, or what are the things that you're experienced? Did you just come out of jail? Because we work with folks that have been justice involved and things like that, right? So there's different care plans for everyone, but it hits all three of those things. So whole person care, right, is one of the key things. Another key component of our care is psychosocial rehab. So that just means essentially, like, if you think of rehabilitation for your knee, or for any other thing that you go through, this is for the psychosocial aspects of your life, right? So if you just came out of prison, what do you need to kind of get back into society? You need housing, get a job, education, whatever it is. So we're there for you in that sense as well. And we created a program, actually, through a grant with Stanford, called Care Plus. And care, it's CARE plus, and it's an acronym for collaborative, uh, approach to recovery and empowerment, right?
Okay.
And so it's essentially saying that we have a team, a multidisciplinary team of folks that are going to work with the patient, and it's a collaborative approach, right? It's, we need the patient's input into the care that they kind of need and want, right? So we'll push a little, right? But you have to also want it. So
Mhm.
there's always that little
Mhm.
dance that occurs, right?
Yeah.
And so that's kind of the last kind of principle, I guess, of our care is it's almost like a care sherpa. And I know that's not a,
Sure.
is it's like you
That's good.
take people into kind of those low oxygen environments, right? And
Yeah.
like, okay, let's keep going
Yeah.
with this, right? You can do it. But if you feel faint, we're gonna, like, kind of, we can come down a
Yeah.
little bit, but we can kind of keep pushing you up. But we're gonna get you the help you need, or so you can finally make it up that mountain, right? And so, and there's various components of the mountains, various dynamics of that mountain, and things like that. You're going to lose your footing in certain areas, but we try to wrap around you with that. So,
Yeah.
really, that's what we're trying to do. And again, the healthcare system is scary, and society is scary. Like,
Yeah.
I don't even know how. Well, one, how to navigate the healthcare system, and I'm
You
in
don't
it, right? Yeah,
know. You do not
yeah,
know
yeah,
how, then we're in
yeah,
trouble.
yeah. And it's tough enough for me, right? And I'm in it, and it's got to be tough for lay people to do that. And if you're dealing with a divorce, or you're dealing with, losing your job and all that, how do you navigate all that? I don't even know how to go. Like, who do I go for housing resources?
Oh my
Who
gosh,
do I go for
so
legal
complicated.
resources if I'm
Yeah.
undocumented? Is there a language barrier that I have to navigate? There's all these things. And I think a lot of people can benefit from kind of a care sherpa, a care coordinator type of
Yeah,
person,
for
right?
sure,
And
for
so,
sure.
yeah.
You've talked about building systems and a continuum of care, a Sherpa of care,
Mhm.
and like you're really thinking of it from this holistic and like kind of overarching view. But what do you feel is that essence of healing at its core?
Yeah. I mean, I'm a real big proponent of kind of this lived experience
Yeah.
and kind of passing it along. I know
Yeah.
it's, you're a great interviewer. So it's like kind
Mhm.
of jogging. It's kind of like, when you think of caveman times, and there's like kind of this storytelling that
Yeah.
occurred,
Mm,
right? That to pass on things to the next generation, right? There's
that's
no, like,
ancient. This is
right?
what we've been
So I
doing.
think it's kind of that storytelling thing, but
Yeah.
maybe it's like beyond storytelling, but it's kind of physical, like this is what you do, and let me show you, let me
Yeah.
embody that for you, let me be that example for you, right? I've done it, I've been to prison, I've been to, been through a divorce, lost my job, whatever it
Right.
is, and
Right.
I've come from another country, I don't speak the language, it's not my native language, whatever it is, being able to then create that, well, one, be vulnerable about telling that story, right? Like we talked about before, but then two, be able to pass that quote unquote wisdom on to
Yeah,
someone and say, look, I've
absolutely.
been through that. Like
Yeah.
let's take the walk together, right?
Yeah.
And but I think that lived experience is important. I mean, there's certainly people that can relate with anybody, right? But then there's some that just, okay, this is what I know, this is what I've done. I've lived on this block forever,
Mhm.
and I can only, relate to that. I wouldn't know how to go to New York City or whatever it is, right? And
Yeah.
so, and that's okay. But
Yeah.
then there's plenty of people to help on that block, right? And
Right.
so I think
Absolutely.
that seems to me, for me anyway, a little biased on just, I think you have to have, as a practitioner, a provider, a clinician, that kind of ability to then relate or tell that story or have that lived experience. I think that goes a long way. There's certainly people that could just be good practitioners of the healing
Yeah.
arts and
Yeah.
just, and they're just good at what they do without even having any of that lived experience. That certainly exists, but I think that just makes it more, um, makes people ready to accept the care, right? It's
Yeah,
very
there's that piece of it, seeing yourself reflected back, but
right,
there's also just things that you know because you've been there,
right,
that
right.
people that haven't been there just don't know,
Right,
you
right.
know?
Like, what would you tell yourself, like, from 20
Yeah.
years ago? "Ah, I wish I could have talked to
Yeah.
myself back then," right?
Yeah,
And
or like
yeah,
you knowing that there's
yeah,
free hospital beds. Like,
yeah,
I would
yeah,
not know that because I
yeah.
did not work there,
Right, right,
so there's
right.
all of that, and but I always find it fascinating and admirable when I meet people that are taking that essence and then creating a
Mm,
system that can then serve more than just one person,
mhm.
but like the masses of
Yeah.
people. So I really applaud you for your work.
Yeah.
Thank you so much for sharing. Um, what you're doing and your backstory and what got you here. Really appreciate that. Now, how would someone connect with your centers?
Yeah, I think the easiest way to do it is online. So mindfullivingcenters.com is a great way to get a hold of us. I think we've got our email link there
You have
and
an
whatnot.
Instagram people can
Yeah,
follow.
we've got an Instagram. So
Yeah,
Mindful Living Centers is on
great,
Instagram as well,
great.
and
So
we're
follow
on
this guy, y'all.
LinkedIn. Yeah, yeah, yeah,
You're
absolutely.
doing great
So
work.
yeah, just reach out to us. And again, it's just like, yeah, when we're doing our work with Racing for Mental Health, that's another organization to plug. So Racing for Mental Health. It's, there's no wrong door, right? And so
Mm,
with that, it's there are a lot of folks that are in that world that have this kind of, again, a machismo attitude, and that's just how they're built and stuff. But you find when you talk to, just like when you talk to anyone, a lot of people are going through stuff, right? It's
yeah.
like there's no judgment, there's no shame. Just come to us. Just, we'll figure out something, and if we can't help you, we'll
Connect.
get you to the right
Yeah.
resource, right? And so yeah, so just come to the website, like I said,
Great.
mindfullivingcenters.com, and yeah,
Wonderful. Well, thank you so much for coming.
yeah, thank you.
Appreciate the work you're doing and taking the time to share it with us.
Well, thanks for this opportunity. It's been
Yeah.
great.